Hi students, welcome to this PG NEET August 2024 recall session. And we have heard that this question paper was moderate to difficult. So I'll be your pediatric teacher covering up your pediatric recalls, whatever has appeared for this exams. And I've gone through those, whatever the recalls, and I feel not so difficult. Maybe it may be easier for me to say as a pediatric teacher is not so difficult. But we wish that you will all do well. Your hard work over months, years should bear a good fruit, and we want to see you with a good score, good rank, and of your subject of a choice, joining a postgraduate courses very soon. So let us go to the pediatric recall. So as you know that these questions are purely recall based. The stems and options may not be appropriate, so please bear with us. I have tried to collect the questions from relevant pediatric subspecialties also, including pediatric orthopedics, pediatric surgery, as well as preventive and social medicine. The first question is child present with fever, tumor over diaphysis, best for diagnosis, and what is the gene associated with this tumor. So moving into the situation, possibly we are dealing with something, the tumor which is very common, the Ewing's sarcoma. And here the correct answer is EWSR1 gene is associated with Ewing sarcoma. Ewing sarcoma, the specific chromosomal translocation, the most often which involves T11 and 22 to a QQ24 to Q12, which results in the fusion of a EWSR1 gene on chromosome 22 with the FL1 gene on chromosome 11. So the answer here, the EWSR1 gene is associated with this tumor associated with Ewing sarcoma, and possible genetic mutation could be EWSR1 gene. Floppy infant, hypotonia, hepatomegaly, and X-ray showing cardiomegaly. So this is one of the differential diagnosis for floppy infants, and here some of the clues are a little misleading. Example is hepatomegaly, cardiomegaly. The moment cardiomegaly, which may give clue for us that possibly we are dealing with congenital heart diseases, but here since this is a hypotonia plus hepatomegaly, so we are dealing with probably the glycogen storage disorder, that is both the hepatomegaly as well as the cardiomegaly. The correct answer is Pompe's disease. 3-year-old boy with rash, a bleeding gum, tourniquet test positive, platelet count 25,000, most important prognostic future. I'm not sure this term is correct here. This term may not be correct here. So looking into a clinical scenario, it looks to be more towards the idiopathic thrombocytopenic purpura. That's why I'm not sure. Again, this term may not be correct. But the options given here, the low platelet count, which is already reflected in the stem, elevated total leukocyte count, hematocrit, peripheral smear, not conveying any messages. So possibly I'm not happy with the stem as well as the options here, but I would consider the correct answer for this question is a low platelet count. Attention deficit hyperactive disorder in a childhood persisting in adolescent is risk factor for what kind of problems? And the correct answer is here, most of these children, ADHD children in a young age, they likely to have a conduct disorder. The right answer is here, conduct disorder. The rest of the answers are not correct here. Unimmunized 5 years old child brought to OPD with white membranous layer seen on throat examination. And what is the prophylaxis for a 2-year-old contact whose vaccination is completed? The moment white patch on the throat, the differential diagnosis possibly in this could be a diphtheria. There may be other differential diagnosis, but if you look into the stem as well as the options, it is the diphtheria here. And there is another younger sibling which has been vaccinated, completed, which means that this child has possibly 24 to 24 months of a vaccination has been completed, including the first dose, booster dose of a diphtheria toxoid. So here, this child contact requires a treatment. So either we can go for oral erythromycin, and the duration could be somewhere around 7 to 10 days, which can be given here, or oral penicillin, or the prophylaxis with the long-acting penicillin, that is the benzathine penicillin, less than 12 kilos. Generally, we give a 6 lakh units, and more than 12 kilos, we give around 12 lakh units. So the answer here, this child requires the oral prophylaxis. The other treatment may be required here to isolation of the child. So this child may not be a contact to others, observation and follow-up. The drug of choice for ADHD. Here the right answer is methylphenidate. The other answers, atomoxetine, amphetamine, guanfacine are the not right answer. Amphetamine may be considered as alternative, but drug of choice is methylphenidate. A newborn baby at 6 weeks, mother brings her with complaints of vomiting, and X-ray showed a single bubble. What is the correct answer option? Duodenal atresia, the options given, annular pancreas, congenital hypertrophic pyloric stenosis, jejunal atresia. Here, the right answer is, it is the 6 weeks is a clue here. Second thing is vomiting, not very clear, but still considered as a non-bilious vomiting. Single bubble is another clue. So possibly this is the answer is congenital hypertrophic pyloric stenosis is a right answer. A child presented with irregular pulse with no signs of hemodynamic compromise. I'm not getting here image of atrial fibrillation. On ECG was given, and what is the management? I'm not sure whether option here stem is atrial fibrillation or supraventricular tachycardia. But please remember here, this child, he is hemodynamically stable, which means that tachycardia is there, pulses are felt well, and no low blood pressure. If it is hemodynamically unstable, remember that pulses may not be felt as well as a low blood pressure. Here, the correct answer is adenosine at 0.1 mg per kilo with a rapid flush should be given, and that is the right answer for this, and this will probably revert the rhythm into a normal sinus rhythm. Sometimes we may have to use a second dose of adenosine, justified, or this persistent to have a persistently tachycardia, then we may have to use amiodarone infusion. only for a child with a hemodynamic instability, then we can consider cardioversion. So the right answer is adenosine 0.1 mg per kilo with rapid flush. Which of the following is wrong with respect to a newborn just after a delivery? A close contact with the mother, yes, this is called as rooming in, required. Warm bath for the newborn. Immediate breastfeeding, yes, required. Cleaning the eyes with the sterile water is required. So this is the wrong. This is in fact, the answer is here is warm bath. We generally do not give bath to any babies. We generally postpone it for 24 hours until the baby is stabilized, because hypothermia is a killer for such babies, and specifically in areas where temperature is a problem. So this is another question related to a growth. The growth chart of a 3-year-old child is plotted, and you can see plot the graph A, which follows the growth centile from this is the birth, and this may be around 3 years of age, and it is follows the birth centile. Whereas the graph B again follows the birth centile, and there is no deviation. But if you see the C, the birth is good. It may be between the 50th to a 75th centile, and then you can see there is a drop in the centiles, a two major centile drop is there. So the right answer here, the growth restriction is C is the right answer here. So identify the correct diagnosis from the image given below here. And this is, you can see the testicles are here, and this is the bladder extrophy is the correct answer, and this is the bladder, and this is also called as the cloacal extrophy. This is also called as the cloacal extrophy. So which of the following growth curves this best describes the brain growth? I'm not sure again whether the sum is correct here, because it looks to be a very straightforward question if you look into the sum, and being in the competitive exams, we don't expect such a straightforward direct question. And here the answer is the figure A. This is the one where you can see the maximum growth of the brain is in the first 2 years of age. So the right answer is the brain growth in this curve depicts the figure A. Whereas the second figure, this is the gonadal growth or development of a secondary sexual characters. So sorry, this is a physical growth, which is we see. This is the physical growth. This is the third figure is the gonadal growth, and the last figure is the lymphoid growth, and the first figure is the brain growth. And 90% of the brain growth is completed in the first 2 years of life. The windswept deformity, tooth abscess, normal calcium, normal or low phosphorus, low parathyroid hormone, high alkaline phosphatase characterize of which abnormality? And here you can see there is a deformity of the ankle joint, there is a bowing of the femur, bowing of the tibia on bilaterally, you can see based on the X-ray. So this is characteristically the hypophosphatemic rickets. Weight bearing joints, particularly the lower limbs deformities, are classically seen in hypophosphatemic rickets. Whereas the vitamin D resistant rickets, type 1, type 2, they may be associated with ricketic changes, but significant skeletal abnormalities or skeletal deformities are not seen. So the answer is here, the hypophosphatemic rickets. The infant present with recurrent chest infection, tachypnea, identify the clinical conditions. So the answer is given here: congenital cystic adenomatoid malformation, right-sided congenital diaphragmatic hernia, congenital lobar emphysema, the cystic fibrosis. And you can see this is the a little hyperinflated chest on right side. This may mimic something like a congenital lobar emphysema, but you can see here this is the malformed portion of the middle segment or middle lobe of the lung. So the right answer is here congenital cystic adenomatoid malformations. So identify the investigation done for a posterior urethral valve. The options given: magnetic resonance urography, ultrasonography, voiding cystourethropy, renal scan using DMSA or MAC3 scan. The right answer is here. It is the voiding cystourethropy, and you can see here there is obstruction and there is dilated urinary bladder, and we are not seeing any reflux here. So this is a characteristically a feature of a posterior urethral valve. Management of a central adrenal insufficiency, it is always the hydrocortisone. Generally we use 12 to 15 milligrams per square meter. So it is the glucocorticoids and mineralocorticoids. The answer is not given here as mineralocorticoids, that is classically a fludrocortisone. Here answer is given only hydrocortisone. So the right answer is here the hydrocortisone. Choose the best investigation for Wilson's disease. And here urine copper, yes, not a right answer, but urine copper after penicillamine challenge test. The hepatic copper, that do a liver biopsy and then document the copper deposition in the liver. So the right answer is the hepatic copper. Serum ceruloplasmin generally on the lower side. MRI brain may show changes in the basal ganglia, but the gold standard diagnosis is a liver biopsy and documenting copper deposits in the liver in this for the diagnosis of a Wilson disease. So then the next question: anemia, hepatosplenomegaly, bone pains, the crumpled tissue paper appearance. The classical answer is Gaucher's disease here, and the enzyme deficient here is hexosaminidase is the right answer. And most of these babies are associated with mental retardation, hepatosplenomegaly, and along with that they may have a repeated respiratory infections. And the Gaucher cells in the bone marrow or foamy cells in the bone marrow are the characteristic feature of this Gaucher's disease. Conjunctival suffusion, hypokalemia, retroorbital bone pain, characteristic of which disease? The answer is here the leptospirosis. So leptospirosis, the characteristic feature is conjunctival suffusion. There may be involvement of a renal system which may leads to a hypokalemia, also myocardial problems in these babies, and the retroorbital pain. So this is characteristic feature of a leptospirosis, conjunctival suffusion as well as the retroorbital pain. 18-month-old child presented with hepatosplenomegaly. 7 gram per deciliter of a hemoglobin. WBC counts are 50,000 cells per cubic millimeter. Peticillin and purpura, what are the drugs recommended? This is definitely based on the scenario. It is acute lymphoblastic leukemia. Most of the answers are here. We use the treatment. Vincristine prednisolone is the most common combination used for the induction treatment, and that is the right answer. IVIG has no role. L-asparginase prednisolone, earlier we use L-asparginase, but now we generally don't use L-asparginase, but it is always L-asparginase combination with cyclophosphamide, vincristine and prednisolone. Daunorubicin is also used, but here the right answer or the most preferred choice as a first line drug for an induction of a ALL treatment is the vincristine and prednisolone. Which vaccine are kept in the lowest compartment of a ice-lined refrigerator? And if you can see here, if I enlarge the picture, this is classically the OPVs are there, which is just kept over the ice packs, and then comes the measles, and then comes the BCG. So the right answer is here, the lowest compartment of the ILR, it is the oral polio vaccine. Whereas the upper portion, the most commonly used other vaccine, hepatitis B and the pentavalent and the diluents are kept on the topmost portion of the container. The X-ray future with anemia, neutropenia, depigmentation, and lines of a Frankel associated with which micronutrient deficiency? The answer is given here. This is the wrong option here. This is the vitamin C deficiency. Sorry, this is correct. Zinc deficiency, vitamin C deficiency, copper deficiency, and this is the selenium deficiency are the options here. It is a zinc deficiency, vitamin C deficiency, copper deficiency, and selenium deficiency. The right answer is here, it is the copper deficiency. Copper deficiency, remember, associated with anemia or neutropenia and depigmentation. And X-ray also shows a characteristic features of the cup formation or new bond formation and increased density at the metaphysis, almost mimicking like a vitamin C deficiency or a vitamin D deficiency. The right answer is here, it is the copper deficiency. The most common type of a congenital diaphragmatic hernia, the left posterolateral, it is also called as Bokdalik. Left anterolateral, it is called as Mogagni. Right posterior, right anterior, the most common is the left posterolateral is the most common type of the diaphragmatic hernia which we come across in the newborn babies. And mostly this is maybe the last question. A 2-month-old infant with congenital rubella with leukocoria, this is could be says that white cat's eye reflex or white reflex, or this could be a cataract. What is the treatment of choice? Cataract surgery at 2 months, cataract surgery at 6 months, no intervention, medical treatment. The right answer is do a cataract surgery at the earliest, and the answer is cataract surgery at 2 months of age. That is the most ideal, so that we can restore the vision in this baby to the maximum. So there's one more question, I think, which is not shown here. The ultrasonographic feature was given. The ultrasonographic feature was given, and for a 6 weeks child who presented with non-bilious vomiting, and which was showing this is a stomach, and then we can see hypertrophic muscles, pyloric muscles, and very thin mucosa was there. So this is the answer here was the congenital hypertrophic pyloric stenosis. So thank you students being online and listening to this recall. So we'll close the session here and wish you all the best, and we look to see you joining a good medical college with good ranks. Thank you.